Here we go. All right, guys, today we have Dr. Elyse Rafal, and I'm really lucky enough to, I go to her quite often. I go to her office every couple of weeks to get some services of my own. She is a board certified dermatologist in Stonybrook, New York, and the president and medical director of DermResearchCenter of New York. She actually has over 100 publications under her belt. I did a little research on you before this went live here. She performs clinical research studies with cosmetic and pharma companies, and we are going to talk a little bit about her business and get under the belt and see a little bit more about her passions and how she got started in the field. So, Elyse, if you can please tell me, what made you want to get into the dermatology field, and how did that turn into building out your own practice?
Well, I've always loved the skin, been fascinated by the skin. It's the best organ of the body because it's the largest one. And when I went to medical school, I really thought a lot about dermatology. I started getting involved in research. I was actually at Mass General Hospital at the time, a wonderful hospital. And I trained under someone named Dr. Gonzalez, wonderful, wonderful man. And I decided at that point to start doing some research in psoriasis, and I found that fascinating. That's how I got involved in research, and I continue that. And I always wanted to treat young people, old people, people of all ages. And I like the surgery, I like the cosmetics, I like the ability to diagnose different things. So it was a perfect fit for me.
Mm-hmm. What would you say is the key to a successful practice in skincare and dermatology?
Well, I think there are a lot of keys. One of the major keys is to really relate to your patients, get to know your patients, and individualize your treatment. Not every patient's the same, and you have to be able to keep up with the times, know when there's new devices out, new treatments, and really keep abreast of the literature.
Mm-hmm. We were just talking a little bit offline before we started this interview. The thing that sets your practice apart is the fact that you have a lot of different lasers and machines and just almost procedures that are available in our area in the East Coast that a lot of the other competition simply does not have. So why is that important to you? It really is almost like it's a pillar for you that you have all these available for your patients, and the people, like the Aerolase, for example. I believe you're one of 6 people or something along those lines. Isn't that the statistic? There's one of 6 people in the East Coast that have the Aerolase, and you're actually one of them.
Yeah, it's very important to have a whole array of devices and medications and treatment options available to your patients, because you really want to have everything available. So if a patient comes in and needs a certain treatment, you'll be able to offer it to them. And not only you have to have it available, but you have to train yourself, you have to train your staff. I do some of the procedures, my nurses do some of the procedures, sometimes we do them together. So it's really important to have proper training and to keep abreast of all of it, because there's always new treatments out there. There's new attachments for different devices, new ways of doing things. So, I'm going to the American Academy of Dermatology meeting this month for a week. And that's a great opportunity for me not only to talk about my research, but I also learn things from other researchers as well, and companies that are developing new products.
Now, Permission to Hustle, the base of the group is really, it's people who are just really starting to build their foundation. And, you're very set, you're established. And so a lot of questions that we get is, how do I know when it's time to expand? How do I know when I'm ready to build out my practice, to get that bigger office, to bring on a team? How did you know when it was time to start bringing on other certified nurses? And you said the people in your office, they also do the procedures. It's not just you. So just looking back just a bit, how did you know when it was to take that moment to go from me being the only person providing services to bringing on people, into my group that would also take some of the load off?
Well, I'll tell you what happened with me, so it would help some people that are listening. What happened was, when I graduated my dermatology residency program, at that time, I went into academics. I was part of the hospital. and I start up my home dermatopharmacology unit. What that is, it's a research unit that work with pharmaceutical companies, cosmetic companies, and industry, developing products and doing consulting with various companies. And I was ready at that point to take that on because I did that as a resident at my residency program at University of Michigan, and they taught me how to do that. They were wonderful. So I was able to do that by myself and be the head of my department then. But I wasn't ready to take on having my own practice in terms of running it, in terms of the financials and so forth, and hiring and firing. So as part of the university, so they did all that part for me. And then almost 8 years later, I said, you know what? I'm ready to be my own boss completely and open up my own practice. And that's when I opened up about 1.7 miles from the hospital. And I was in charge of everything, hiring, firing, ordering supplies, everything in my own office. So that was a big change, but I was ready for it at that point. You know, I knew what to do, and I wanted that challenge. So half of it is you want that challenge. You have the patient population, and you just go for it. And it was really proved to be very successful. And then what happened years later, I decided I wanted to add more cosmetics to my practice. So I was ready at that point because my patients were asking for it. So I had to hire nurses that, you know, specialized in that, train them, and so forth. So you have to really go with what you're ready for at the time, what your patients are asking for, or what your clients are asking for, and do a lot of research. I did a lot of research. Like when I bought cosmetic machines like lasers, I researched them for years before I even purchased one. And you want to make sure the machines work, they're safe, they're effective. That's very important. I did a lot of research. You have to speak to a lot of people in your field too that you trust.
Right. This is just the last question, and thank you for giving me the time today to speak with you. What's one tip that you would give to a female entrepreneur, a woman that's sort of just jumping into your field? What's one tip that you would give them as they begin their journey to sort of hopefully get to your point one day?
I always tell people, do what your passion is. Don't do what people tell you to do or because it's lucrative or for whatever reason. You do it because you love it. Because at the end of the day, you have to be happy 24 hours a day, 7 days a week. That's your goal. And I love what I do. So you want to be able to love what you do. Yeah. And then you're successful.
Thank you. That is sound. That is sage advice. So thank you so much. Thank you. I will actually put all your information below, but it's rafaldermatology.com if you'd like more information on the practice. If you are a New York City, New York, tri-state area resident, you can definitely go check them out. I've been using their services for several months now, actually, and I can't get enough, to be honest with you. So I just cannot thank you enough for giving me some time today. I know you are very busy, and I will see you soon.
Thank you. You're the best.
Thank you.